1,000 hospital beds into circulation. This is the first time this kind of deal has been done between NHS England and independent providers. We're told that the beds are being supplied at cost. Dr. Layla McCay is the Director of the NHS Confederation, the body that represents the UK's health authorities and trusts, and she's with me now. Well, this sounds like good news, Layla.
Absolutely. I think that in this time when we're all so concerned about whether we're going to have capacity to deal with this challenge, it's really heartening and inspiring to know that there's about 20,000 more staff standing by ready for action.
And how much of a game changer is that?
Well, I think it's quite significant. As well as the staff, you referred to the doctors and nurses, there's also another 80,000 clinical staff all pitching into this effort. Also, this increase in hospital beds, incredibly reassuring to know that we have another 8,000 hospital beds ready. And of course, with that comes the extra ventilators as well. My understanding is there's about 1,200 extra ventilators within the independent sector that are all going to be available for this effort as well. So I think that really this is seeing all parts of the health sector pulling together for this national effort is comforting and it's inspiring.
And do we know, Layla, if those ventilators are going to be distributed evenly throughout the country, or is there some operation where they're going to be moved around depending on need, or will the need be everywhere?
I don't have that exact information, but from what I've heard, there's going to be ongoing analysis of where the need is, and that is where the ventilators will be used.
So what are next steps then? What happens next?
Well, it sounds as though this extra capacity is going to be available to the NHS by Monday, and that essentially these people, they're all fully trained, although they may also, of course, have to be trained in particular things like how to use PPE. They may have to be trained in certain things if they're being expected to shift their roles at all, just as people in the NHS are being. And as we know, the independent sector hospitals are inspected, etc., in just the same way as the NHS are. So these people are ready for action, and the quality of the hospitals is right there, the same as the NHS. So this is very reassuring.
Here's something, Dr. McCay, I don't understand, because we see how the NHS is scrambling for whatever resource it can get, be it people, be it machinery, to save lives. And the government is asking people to exercise this social distancing, in other words, physical distancing. I'm just asking you this as a citizen rather than as a director of the NHS Confederation. Are you curious as to why the government isn't making it law? Why are they not requiring us to socially distance if it will save lives?
I think there's a lot of complexity to these things, and certainly it's not for me to say what should be law or what shouldn't be law. I think that what is very clear is certainly that people do need to take responsibility for this. This is a nationwide challenge. This is a nationwide responsibility, and it's something that we should all be looking at as to whether it should be law or anything like that. That's something that's being discussed at the moment.
And yet I'm seeing, I'm seeing coming into Five Live people pointing out examples from all over the UK where some people were still going out, very close to each other today, doing whatever they do, whether it was close shopping with their friends or whether it was going down to the beach or the park together, all very close to each other for those people who were pointing it out to us. Now, what is that about? What bit of this do people not understand, Layla?
I think it's very difficult sometimes to imagine the scope and scale of this emergency. Things happen in other countries and it feels like it's a little bit far away sometimes. It's hard to connect that with what's here. And actually people really need to stop and think, my goodness, I'm hearing what the scientists are saying. I'm hearing what these incredibly hard-working people in the NHS are saying about what they're seeing and what they know is coming down the line. And just letting that strike home and thinking, goodness, this is going to be huge. What can I do to help? What can I do to try to reduce the risk? It's something that everyone can contribute to, but I think that it really takes a while to sink in that is such an imperative when we're still at a fairly early stage on the curve.
What is coming down the line?
Well, I don't have a crystal ball. I can't say what's coming down the line, but certainly what we're seeing in terms of the trends from other countries and in terms of the mathematical modelling that has been done and redone and looked at by all sorts of experts, we're expecting a significant increase in the demand on the NHS as more and more people catch this COVID-19.
OK, Dr. McCay, thank you very much indeed.